We should now turn our attention to the posterior compartment of the thigh. The posterior compartment of the thigh is noted for having three main muscles: the biceps femoris, the semimembranosus, and the semitendinosus. Now the adductor magnus muscle lies interposed between the medial and posterior compartments of the thigh, and there's no definite intermuscular septum there. So, first of all, if we start off with the muscles, the muscle in the lateral aspect of the posterior thigh is the biceps femoris muscle. It consists of two heads. It consists of a long head, which attaches to the ischial tuberosity above, in common with the semitendinosus muscle. The long head then passes downwards and laterally across the thigh and joins with the short head to form a tendon of the biceps, which attaches to the styloid process of the fibula below. The styloid process is the head of the fibula below. Now, the lying underneath the long head of the tendon of the biceps, so the long head of the biceps, is the short head of the biceps. Now the short head of the biceps attaches to the lateral lip of the linea aspera above and joins the long head of the biceps to form the tendon of the biceps, which attaches to the head of the fibula below. The next muscle that we should look at is the semitendinosus. Now the semitendinosus arises from the ischial tuberosity above, in common with the biceps femoris tendon. It passes downwards on the semimembranosus muscle, which lies underneath it, and then passes behind the medial aspect of the knee to insert onto the upper medial surface of the shaft of the tibia, with the other tendons of the pes anserinus. Now is a good time to see these tendons of the pes anserinus. So if we tilt this model around so we see the medial aspect of the knee, here are the three tendons of the pes anserinus from front to back. We have the sartorius muscle tendon, the gracilis tendon, and the semitendinosus tendon. Now all of these tendons once again converge to attach to the upper medial surface of the shaft of the tibia here. So moving once again back to the posterior compartment of the thigh, if we remove the semitendinosus muscle, we see the semimembranosus muscle. Semimembranosus muscle arises from the ischial tuberosity, from an area above and lateral to the conjoint origin of the biceps femoris and the semitendinosus muscle. So the semimembranosus muscle passes downwards deep to the semitendinosus tendon, which is here. So if we see it, we then can follow the muscle down to its insertion onto the back of the medial condyle of the tibia. The muscle underneath all these muscles in the back of the thigh, if we remove the biceps femoris and short head and the semimembranosus, is the adductor magnus muscle. As we said before, the adductor magnus muscle, so we'll remove the biceps femoris tendon as well. Now the adductor magnus muscle, as we said before, lies between the medial compartment of the thigh and the posterior compartment of the thigh, and there's basically no defined intermuscular septum here. The next thing is the function of the posterior compartment. The posterior compartment has a number of muscles, all of which function to either flex the knee, and extend the hip. They're all supplied by the sciatic nerves, mainly through the tibial part, except the short head of the biceps femoris, which is supplied by the sciatic nerve through its common perineal part. The final thing that we need to consider with the muscles of the region is the muscles of the gluteal region. Now the muscles of the gluteal region are basically arranged in two main layers. First of these layers is the large gluteus maximus layer, which arises from the posterior aspect of the iliac crest, the posterior surface of the sacrum, and from the sacrotuberous ligament below this. The muscle fibers pass downwards and laterally, and the upper 3/4 of the fibers insert onto the iliotibial tract, which we've talked about before, and the lower fourth of the fibers insert onto the lower fourth of the fibers insert onto the gluteal tuberosity on the posterior surface of the femur. If we remove the gluteus maximus muscle, we expose the layer of muscles underneath it. The layer of muscles underneath it is the gluteus medius, the piriformis, and the other short external rotators, which we will talk about. The gluteus medius muscle arises from the posterior surface of the iliac bone, in between the posterior gluteal line and the anterior gluteal line. The muscle fibers pass downwards and forwards and insert onto the anterior surface of the greater trochanter of the femur. If we remove the gluteus the gluteus medius muscle, we see underneath it the gluteus minimus muscle. Now, the gluteus minimus muscle arises from the outer surface of the iliac bone, in between the anterior and inferior inferior gluteal lines. The muscle passes downwards and inserts onto mainly the anterior surface of the gluteal tuberosity also. So if not the gluteal tuberosity, the greater trochanter of the femur also. So if we remove this, we basically have the superior aspect of the hip joint. But before we talk about this, we should talk about the other muscles in the region. So the first muscle is the first muscle we're going to talk about now is the piriformis. Piriformis arises from the pelvic surface of the second, third, and fourth pieces of the sacrum. The muscle passes out of the greater sciatic foramen. It's related to the back of the hip joint, and it passes, and its tendon passes to insert onto the superior border of the greater trochanter. The piriformis is a major landmark for nerves and vessels in the region. We'll talk about this later. The next muscle to talk about is the obturator internus muscle. The obturator internus muscle arises from the internal surface of the obturator membrane and the bone of the obturator foramen. It passes laterally out of the lesser sciatic foramen, and then passes behind the hip joint to insert onto the medial surface of the greater trochanter, with two small tendons which flag it, the tendons of the inferior gemellus and the superior gemellus. Now, these muscles arise above and below the lesser sciatic notch of bone, and pass with the obturator internus to its insertion on the medial surface of the greater trochanter. The last external rotator is the quadratus femoris muscle. The quadratus femoris muscle arises from the lateral surface of the iliac tuberosity, so the ischial tuberosity, and it passes laterally to insert onto into the tubercle on the intertrochanteric crest on the posterior aspect of the femur. To be honest, I've forgotten what that tubercle is called, but The next thing that we can notice about the quadratus femoris is if you remove it, lying deep to it is the obturator externus muscle as it passes behind the neck of the femur to its insertion into the trochanteric fossa on the medial aspect of the greater trochanter. Now that we've considered the gluteal muscles, we should cover their nerve supply. Now the nerve supply in action, the gluteus maximus is supplied by the inferior gluteal nerve. The gluteus minimus and medius is supplied by the superior gluteal nerve. The piriformis is supplied by branches from the sacral plexus, and the obturator internus and superior gemellus are supplied by the nerve to obturator internus, which is a branch from the sacral plexus. The inferior gemellus and quadratus femoris is supplied by the nerve to quadratus femoris, which is a branch from the sacral plexus. Don't be too alarmed by all these nerves, we will cover them in a subsequent section. The main function of muscles is different for each of the groups. So the gluteus maximus's main function is in extension of the hip and lateral rotation of the thigh. The gluteus minimus and medius muscles assist in abduction of the hip, and also in posture it prevents the pelvis from tilting to the other side. So when these muscles are paralyzed, you end up with a characteristic gait. The muscle, the piriformis, as well as the muscles obturator internus, the gemelli and the quadratus femoris, are all responsible for external rotation of the thigh.